Now, as of October, Europe has more than 8,700,000 cases of coronavirus, according to the European Centre for Disease Prevention and Control. The 5 countries reporting most cases are Russia, France, Spain, which have all recorded more than 1 million cases each, and the United Kingdom and Italy, which have both confirmed more than 500,000 cases. The surge in the number of new cases comes as Europe is experiencing a second wave of COVID-19 infections. As a result, European countries are again tightening measures to halt a sharp rise in the number of new coronavirus cases. For example, Spain, as one of the first countries on the continent to record over 1 million cases, has declared a state of emergency and enacted a new round of lockdowns countrywide. Even Belgium, which has seen smaller numbers of infections compared to the leading hotspots in Europe, has recorded more than 100,800 deaths as of Tuesday, according to figures from the European Centre for Disease Prevention and Control. Joining me on the line from Brussels to discuss this development is Anna Van Deske, a journalist and political commentator. Thank you for joining us, Anna.
Good evening.
Good evening. And now to begin with, what do you think have prompted the sudden rise in new cases across Europe?
Well, of course, being not scientist, I can't tell you what is the reason, because there is no unity in opinion of scientific community, and every country has its own way and its own insurance system to deal with the new rise of coronavirus. But also there is a lot of criticism among scientists of the exactness of the test, because there are different methods who allow to trace coronavirus. And, there is a privilege among science, let's put it like that, that some of them think the tests which were produced officially are not any more efficient, and that's why their numbers are not correct. But I think that the biggest problem is that the healthcare is not a shared responsibility. So each country has its own responsibility, and that's why there is no united answer.
Now, how is Europe as a group responding to this second wave of the coronavirus infections?
Country has its own method, because, for example, France and Belgium, they have curfew, and people can't go out in the street. Like now in Brussels, where I am, I have to go home before 10 o'clock in the evening, and I have to stay inside until 6 o'clock in the morning, because that is the imposition of the government, with exception on people who really need to go to work, or they have urgency, medical urgency, or other social care urgency. But basically, there is a very much criticized by human rights groups measure, because there is no proof that it's efficient. And for example, in Sweden, people are not even wearing masks. So it's very diverse. The answers to COVID are very diverse. It's a disease, it's a virus that is very little known about. And that's why today we have such a mixed and sometimes even chaotic answers.
So, could this new surge in coronavirus infections in Europe be considered a setback for the continent as a time when some countries began losing lockdown measures rather?
Yes, of course. For example, now here in Belgium, there is a great concern that many people who work in hospitality sector, in hotels, in bars, in restaurants, in cafes, and Brussels, for example, and Belgium coast is also very remarkable for number of high quality hotels and restaurants who are always welcoming tourists from different continents. But unfortunately now they all have to close down again. And the representatives of the trade unions said that very few will really survive it, because they are expecting the wave of bankruptcy by the end of the year. Because as you know, there is a perspective that was formulated by President Macron, President of France, that most probably the COVID measures should stay until next summer. So the entire winter we have to live with the measures, although not curfew, but still there are a lot of restrictions, sanitary restrictions falling onto the public places, on the gyms. Of course, the entire culture is now under strain. So all these people are out of work, and the question is, how long can it last? Because half of our Europeans can't be on social welfare, so it simply will not work like that.
It's indeed practically impossible for people to stay indoors all the time. But how do you think this new wave is going to affect other countries?
Well, it's difficult to say because, like Africa, for example, you are hardly touched by COVID because you have very young people. So African population is different than European population, and namely than population of countries like Belgium or the Netherlands, because here life expectancy is 87 years. And so in Africa, in very few countries, you have such a high life expectancy. So of course, people in certain age, senior citizens, are very much fragilized by this situation, and also they suffer in a emotional way because the visits are prohibited. They can't see their close ones, and each family bears this burden of restrictions. Even in the streets, people can't gather more than 4 together. So all that poses a very big strain on the society, not only economically, but also emotionally. And it's a very hard time that is awaiting for us, because it will go on, it looks like, until New Year for sure, and maybe even longer.
We hope to see a decrease in the number of COVID-19 cases around the globe. Thank you so much, Anna.
Welcome.
Anna, a journalist and a political commentator, speaking to us now.